Today we will be talking on vasculitis. So let me write it here, vasculitis. So what is vasculitis? As the name implies, it is inflammation of the blood vessels. So let me draw the blood vessel for you. So this is the blood vessel, this is the endothelial lining, you can see, and this is the basement membrane, and here this is muscular layer, and here adventitia. So when there is inflammation, neutrophils recruitment here or eosinophils recruitment, then this inflammation is not only limited to endothelium. This is called a transmural inflammation, and it is not, the inflammation is not continuously involved along the length of the blood vessels. It skips the segments. Here there is inflammation, then here inflammation, here inflammation, and it skips the segment. So the inflammation may not be continuously present along the segment of blood vessels. And when there is inflammation, then what happens? There is the gap junctions, there is the leakage of the cells, RBCs occurs from this inside the blood vessels to under the skin, and so that's why you can see palpable purpura due to extravasation of the RBC under the skin. And you can also feel the purpura, that's why I've called it palpable purpura. In case of thrombocytopenia or qualitative dysfunction of platelets, when there is RBC accumulation under the skin, it is not palpable. But here, due to transmural inflammation of the blood vessels, you can feel the purpura. So when there is inflammation in a segment of blood vessels, what happens? There is inflammation, then there is more recruitment of the cells, and you know this is one of the Virchow triad. It disturbs the rheostatic properties of the blood, and due to there is thrombus formation. So due to this thrombus, there can be either partial obstruction of the blood vessels, or if it is completely occluding, then it causes complete occlusion of the blood vessels. And due to inflammation, what can occur? It can go either inward or can go outward. Outward meaning, I mean to say that there is inflammation, so there is weakening of this portion of the blood vessels, and so it protrudes like that. That is called aneurysm. Aneurysm. So there can be either stenosis or aneurysm of the blood vessels. So this is the basic pathophysiology of vasculitis. So vasculitis, depending upon the size of vessel involved, these are classified as large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. So let me draw. This is aorta, and when there is involvement of the aortic arch, this carotid artery, this subclavian artery, then this is called large vessel vasculitis. But when involvement of the mesenteric artery, when involvement of the renal artery, then we call this medium-sized vasculitis. And when there is involvement of the arterioles, capillaries, venules, we call this a small vessel vasculitis. Okay. So depending upon that, this vasculitis is classified as Takayasu arteritis, giant cell arteritis. These are classified as large vessel vasculitis, large vessels. Similarly, polyarteritis, this is nodosa, this is classified as medium-sized vasculitis. Medium-sized blood vessels are involved. And third category is a small-sized vasculitis, which include ANCA vasculitis. So one is C ANCA, another is P ANCA. So C ANCA, granulomatosis with polyangiitis. Here you can see C ANCA. In P ANCA, there can be microscopic polyangiitis or eosinophilic granulomatosis with polyangiitis. Okay, so these are different types of vasculitis. So you know it is inflammation of the blood vessels, and when there is involvement of the blood vessels, definitely it is in some organ, like in whether it's in lung or glomerulus involvement in the kidney, or whether in the skin, wherever these blood vessels are present. I mean to say that it involves the organ where these blood vessels are present. No? So depending upon that, the clinical features may vary with these different types of vasculitis, but what are overall common features? These are called constitutional symptoms. Constitutional symptoms. So when there is inflammation, so it can cause fever, it can cause malaise. Due to cytokines, it can cause weight loss. So these are some of the common features you can see in almost all types of vasculitis. And depending upon the site of involvement, for example, if it is involvement of the pulmonary capillaries in the lungs, let's suppose this is lungs. Now, and when there is pulmonary capillaries involvement, so RBC leaks inside the alveoli and you can cough of this blood. So that is called hemoptysis. Hemoptysis, shortness of breath due to alveolar hemorrhage, shortness of breath can occur. Okay, so if it is involvement in the lung. Similarly, when there is a glomerulous involvement, it can cause hematuria, proteinuria, and when there is a skin involvement, so you can get palpable purpura, nail vault infarct. So this palpable purpura can be anywhere in the upper limbs or lower limbs. And another is claudication. So I told you that there is a stenosis of the blood vessels. So when there is facial artery stenosis, it causes jaw claudication. When there is subclavian artery stenosis, it causes upper limb claudication. While doing exercise of the upper limb, claudication can occur. And if there is involvement of the blood vessels in the lower limb, this can cause lower limb claudication. So depending upon the site of involvement, the symptoms vary. Okay. So whenever any patient present with any symptoms, like let's suppose in our OPD, when a patient presents with complaint that I have paresthesia of my upper limb, lower limb, and when you do nerve conduction study, you get a feature like mononeuritis multiplex. So whether you need to work up for vasculitis or not in this case, so that depends upon other features present, like when you see palpable purpura, young female. So obviously you need to consider that vasculitis can be one of the cause, and you have to progress your investigations in that line. You have to go forward to investigations in that line. So first of all, you have to rule out infection, because infection can mimic vasculitis. The infections like hepatitis B, hepatitis C, HIV, tuberculosis, this can mimic vasculitis, or it can be even coexistent with vasculitis. So first of all, you have to treat infection before treating vasculitis with immunosuppressants. So you have to send for procalcitonin to rule out if there is any bacterial infections like brucella, leptospirosis. These can mimic vasculitis. So first and foremost thing is that you have to rule out infection. For example, I can remember one case that has initially presented with palpable purpura and fever, and one workup we got tricuspid valve endocarditis. So initially it looked like vasculitis, but on further workup we found infective endocarditis. So we have to rule out infections first of all in any case of vasculitis. And even if the infection can coexist with vasculitis, so before starting immunosuppressant, you have to treat underlying infection. And treatment is, steroid plus minus immunosuppressants like cyclophosphamide, azathioprine, biologicals like tocilizumab. So depending upon the type of vasculitis, these vary, but this is overall. Okay, so now let's talk individually. So first of all, let's talk about giant cell arteritis and Takayasu arteritis. So giant cell arteritis, this both involves the aortic arch and its branches, but the predilection for giant cell arteritis is external carotid artery and its branches like facial artery, temporal artery, and Takayasu generally involves aortic root and its branches like vertebral artery, carotid artery, and this is generally seen in age greater than 50-year-old. This is disease of young. In less than 40-year-old female you can see, but the involvement is almost similar, this distribution of the vasculitis. And in giant cell arteritis, temporal arteritis, since it can threaten vision, so before you send for biopsy of the temporal artery, you have to start prednisolone plus tocilizumab. Prednisolone plus tocilizumab. Okay, in other type of vasculitis you can wait, but this is sight threatening, so you have to start prednisolone with tocilizumab. And in Takayasu arteritis also you need to give a steroid along with cyclophosphamide. Depending upon the severity of the organ involvement, you choose immunosuppressants, how much to give, and whether to give combined immunosuppressants or only steroids. Those obviously need to decide on individual basis. And second is polyarteritis nodosa, which is medium-sized vasculitis. So it is not only medium-sized vessel vasculitis, it can involve small vessels as well, small vessels. So as the name implies, polyarteritis nodosa. So you can see the nodules, like you can see the string of pearl sign. When you do angiography, CT angiography, you can see a string of pearl sign in the renal artery. For example, let's suppose this is the renal artery. So you can see the picture like this. Because it is not continuously involved, somewhere it is involved and stenosis, somewhere it is spared. So it looks like a string of pearl in angiograph. So we call it a string of pearl sign. And due to this stenosis, what can occur? Renovascular hypertension can occur. Renovascular hypertension can occur. And similarly, it can involve the mesenteric artery, and due to that, abdominal angina can occur. Abdominal angina after eating food. And similarly, it can involve cutaneous vessels as well. So you can get palpable purpura. So this immune complex can deposit even in the small vessels. So majority of the time it involves the medium-sized vessels, but the small-sized vessels are also not spared in this. So you have to remember that. And the treatment is again prednisolone with cyclophosphamide. And the third category is a small vessel vasculitis. A small vessel vasculitis. So here, NK vasculitis. So you know, these two type of NK, CNK, PNK. So CNK, you get granulomatosis with polyangiitis. PNK, eosinophilic granulomatosis with polyangiitis and microscopic polyangiitis. The treatment is similar, but generally they involve the respiratory tract. So we can see allergic rhinitis, nasal polyps, sinusitis like picture, and in the lungs you can get cavitations in Wegener's granulomatosis. No? And similarly, in addition to that, you can involve pulmonary capillaries, so it can cause hemoptysis, can involve glomerulus, can cause hematuria, proteinuria. Okay. So this is in short about vasculitis in general. So it is of three types: large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. Large vessel vasculitis means involving aortic arch and its branches like thoracic aorta. It can involve abdominal aorta, it can involve, and you can get aneurysm in the abdominal aorta, thoracic aorta due to weakening of the blood vessel walls. Involvement of the carotid artery can cause a stroke. Involvement of the vertebral artery, subclavian artery, due to subclavian artery stenosis, what can occur? You can get difference in blood pressure in the both arms, because if there is a stenosis is only this side, you get low BP in this side and high BP in this side. So you can even get pulselessness, that is called pulseless disease, Takayasu arteritis. Because of the stenosis in this subclavian artery, you may not feel pulse. So that's why it is called pulseless disease, and you can get upper limb claudications as well. So that is about large vessel vasculitis. And in medium vessel vasculitis, I told you that it can involve the even it can involve subclavian artery, it can involve mesenteric artery, it can involve the renal artery. Okay, and in addition to a small vessels involvement as well. And in a small vessel vasculitis, generally they are called anacavasculitis, means granulomatosis with polyangiitis, eosinophilic granulomatosis with polyangiitis, and microscopic polyangiitis. The treatment of this all small vasculitis is same, steroid plus cyclophosphamide, but they differ little in terms of the clinical presentation. We know in Wagner granulomatosis what occurs, nasal sinusitis can occur, you can get cavitations in the lungs, pulmonary capillaritis can occur. Due to that, hemorrhage means hemoptysis can occur. So this is overall in short about vasculitis. So hope you understood this. Thank you.